Hi guys, good evening, good evening. I hope everybody is doing well. कोई सवाल, कोई शक, कोई problem? Right, so Saturday we had this INICET recall also, है ना? So INICET exam was done. Surgery was more or less quite doable. मतलब if you have attended our sessions, even with BLS, you could have aced that exam. Okay, hi Om Prakash, hi Jamina, good evening. Right, so I hope everybody knows that today's point of discussion is going to be our stomach. Okay, so we're starting a new series today. So we have finished esophagus last week. We have done all the important topics that are there on the esophagus. So today's focus would be on stomach, right? So we're talking about every single aspect in the stomach. ठीक है, तो आज हम बात करेंगे स्टमक के बारे में. पापी पेट, स्टमक, स्टमक इज व्हाट. देखो, स्टमक ऐसे बदनाम है ना, वैसे टू बी वेरी ऑनेस्ट, पापी इंटेस्टाइन होता है, ठीक है, पापी पेट नहीं होता. स्टमक पर से हैज lesser disorders when compared to bowel. Bowel are of a more wider spectrum, लेकिन वैसे ही अपना स्टमक बदनाम है. ठीक है, so today we'll be talking about the surgical anatomy of the stomach and the basic physiology. If time permits, I'll add one or two topics here and there. So when you talk about the stomach, we'll dig into each and every single component. We'll start with the basic anatomy, and then from there on we'll continue to build across it. ठीक है, चलो. So when you talk about the stomach, now take this as the representation of the esophagus. The esophagus ends and you have the beginning of the stomach, and this is how the orientation of the stomach would actually look like. Like nothing spectacular about it. Everybody knows this is the basic orientation of the stomach that we have. Now, when you look closely, the first thing you'll see is the gastroesophageal junction that is present. From there, the stomach would start. The initial part of the stomach is what we call it as the cardia of the stomach. This is what we call it as the cardia of the stomach. This part of the stomach is what we call it as the fundus of the stomach. This happens to be the fundus of the stomach. This happens to be the body of the stomach. Then comes the antrum of the stomach. And the last part is the pylorus of the stomach. So these are the various parts of the stomach that you have, right? So it starts from the cardia, then you have the fundus, the body, and the antrum of the stomach, right? Now when you see this part of the stomach, which is present here, this inner circle is what we call it as the lesser curvature of the stomach. This happens to be the lesser curvature of the stomach, and this happens to be the greater curvature of the stomach. So this happens to be the greater curvature of the stomach. This happens to be the greater curvature of the stomach. It is the greater curvature of the stomach, right? Now, from the greater curvature of the stomach, a very important thing is going to arise, right? I hope everybody knows it. What is it we are talking about? From this aspect of the stomach, you see this is something which is going to fall like this, right? So what is that is arising from this greater curvature of the stomach? Any idea? This is what we call it as the omentum. So omentum is actually a biliate structure which is folded twice, right? So this you can see right across here. So this is what we call it as the omentum. Omentum is going to be arising from the greater curvature of the stomach. It is a biliate structure which is folded. So it is altogether 4 layers. Is altogether you have the 4 layers, right? So you can see this happens to be the fundus of the stomach, or let's a different color. This happens to be the fundus of the stomach. This is the greater curvature of the stomach. Right. So one that is arising from the greater curvature will be a greater omentum, and then you have a lesser omentum, which is on the lesser curvature, right? So omentum basically arises from the greater curvature of the stomach. It arises from the greater curvature of the stomach. It is a bi-layered structure. It is a bi-layered structure that you have. सुरेश फीलिंग डिप्रेस्ड आफ्टर आईना बेटा रिजल्ट थोड़ी ना आया है यार, अभी तो एग्जाम ही दिया है, ठीक है। आई विल टेल यू व्हाट, आईना एग्जाम जो था दिस बार का, इट अपीयर्ड टू बी सिंपल, लेकिन ऑप्शंस वर ट्रिकी, हमेशा होता है, ठीक है। तो अगर इफ यू आर फीलिंग डिप्रेस्ड, दैट मींस यू हैव नॉट गिवन द एग्जाम वेल, दैट मींस यू आर एबल टू असेस द क्वेश्चंस वर डिफिकल्ट, सो यू आर एबल टू आंसर अकॉर्डिंगली, ठीक है। तो हारना नहीं है। एंड to be very honest, it is more like another GT. It is more like a net practice. But agar INI is basically a litmus test for you to know where you stand. Agar INI mein aata hai, you go and take your seat. Otherwise, it's basically a checkpoint for your NEET PG. तो अब यहाँ से ये पता चल जाएगा कि यार NEET PG के लिए कितनी मेहनत करनी है, ठीक है। तो उसके हिसाब से फालतू में दिमाग नहीं खराब करना। आईना हो गया, अपना काम है, देखो कर्म करो, फल की इच्छा देखी जाएगी, देखी जाएगी, सेम वही बात है यार। दे दिया एग्जाम, अब आएगा रिजल्ट, रिजल्ट थोड़ा रोक सकते हो, जो आएगा रिजल्ट तब देख लेंगे। देखो जो भी है हंसना रोना एक ही दिन में होना चाहिए बेटा, कोई कैरी फॉरवर्ड नहीं होगा। जिस दिन रिजल्ट आया उसी दिन हंस लो, उस दिन रो लो, उसके अगले दिन हमेशा नया दिन होता है। देयर इज नो पॉइंट ट्राइंग टू sit back and try to कि what has happened, it has happened, you have given the exam, the result will come in a week or so and then it will be done, ठीक है। तो ज्यादा दिमाग नहीं करने का, ठीक है, आराम से रिलैक्स रहो, you will have a lot of opportunities in life। एक लौता एग्जाम नहीं है जो बाकी your life is going to be determined, but things are changing very fast, ठीक है। आगे चल के आई एम बीन टेलिंग यू द AI is going to be far far more important and it is having a very important role in going forward। तो क्या पता आज जो important branch है कल ना important हो, आज जो इंपॉर्टेंट फील्ड हो कल ना इंपॉर्टेंट हो। तो भाई लाइफ इज ऑल अबाउट सरप्राइजेस यार, बी चिल अबाउट इट। दे दिया एग्जाम ना, ठीक है, आगे का सोचो, आगे क्या सोचना है, नीट पीजीए, ठीक है, ज्यादा दिमाग नहीं लगाना। ऑलराइट, चलो। So this is the basic orientation of the stomach that you have, ठीक है। Now when you talk about the various components, one of the important things that you will see is there are different kinds of cells which are going to be present inside the stomach. We'll try to understand. Okay, before we go into the cells, I'll go into the blood supply of the stomach, which is quite interesting, okay? So we'll go and talk about the blood supply of the stomach. I hope everybody knows the blood supply of the stomach comes from the celiac artery. It comes from the celiac artery, right? Many a times it has been asked that how do you remember? One of the major, even in your university exams or your viva questions or your NEET PG or a NACT, हर किसी में ये सवाल बहुत important है, blood supply of the stomach. Once you understand this, doing the surgery becomes quite easy for us, ठीक है। Now you take this as the representation of the stomach, that is esophagus. This comes out to be the stomach and this happens to be the duodenum that is present, right? Now right behind this you have the aorta which is running, so this is the representation of the aorta. Let's say this happens to be the aorta that is present across it, okay? Now from the aorta you see there's an important branch that is going to come out and that is going to be your celiac artery, right? Now this celiac artery that is going to arise from here, it is going to give rise to three major branches. We remember as left hand size LH is the mnemonic. There is going to be the left gastric artery which is going to be going in this particular manner. So this is your left gastric artery which is going. Then you have the hepatic artery which is going to go here. This is the hepatic artery. And then you have the splenic artery which is going to go behind this, right? So just start a little bit higher up. This is the celiac artery. You have the left gastric artery which is arising and going like this, right? This is going to be the hepatic artery which is going to be from this point. This happens to be the splenic artery. So this is your left gastric artery, which is going right. So this is your left gastric artery that is going to supply. This happens to be the splenic artery that is going to go behind the stomach. It is going to go behind the stomach. As it goes behind the stomach, you have the spleen which is present here. This is going to go and supply to the spleen. So this is going to be your splenic artery. This is going to be the splenic artery. Now, as soon as it gives rise to the splenic artery or gives rise to the spleen, it starts giving on a retrograde manner, which is the short gastric arteries. And these short gastric arteries are going to supply to the fundus of the stomach, which are invariably a branch of your splenic artery, right? Now, from the same splenic artery, you will see there's another branch that is going to arise. That is going to be your left gastroepiploic artery, which is also called as the left omental artery, right? So as we go down, I'll continue to label so that we remember better. So this is your celiac trunk or the celiac artery. This happens to be your left gastric artery. This happens to be a left gastric artery. This happens to be your splenic artery. This happens to be your common hepatic artery. This happens to be your common hepatic artery, which is this happens to be your common hepatic artery. Somebody is asking, sir, आप नीट पीजी की तैयारी कर रहे हो? बेटा, हम नीट पीजी की तैयारी करवाते हैं. हमारा नीट पीजी हो गया, हमारा नीट सुपर स्पेशलिटी भी हो गया, ठीक है, हमारा पोस्ट फेलोशिप भी हो गया. तो हम थोड़ा आगे निकल गए, तो नीट पीजी पीछे रह गया. तो हम उनकी मदद करते हैं जो नीट पीजी निकालना चाहते हैं, ठीक है. तो इट वाज अ क्यूट क्वेश्चन, बट ना बेटा, आई डोंट वांट टू गिव नीट. मैं फिर उस टॉर्चर से वापस नहीं जाना चाहता हूँ. एक बार कूद चुके हैं, फिर वापस मैं उस आग में नहीं जाऊंगा. आई नो हाउ डिफिकल्ट इट इज. आई हैव इमेंस रिस्पेक्ट एंड इमेंस अमाउंट ऑफ ग्रैटिट्यूड as well as sympathy, empathy to every single aspirant of the NEET or the INI who is currently preparing. Beta, you guys are like top notch. There is no if and but in that. ठीक है? Yeah. चलो. So there are celiac artery के 3 branches हैं. So we remember the celiac artery that you have. When you talk about the celiac artery has 3 branches. Mnemonic to be remembered is left hand side, that is L, H and S. Okay. L stands for your left gastric artery. H stands for common hepatic artery. S stands for your splenic artery. ठीक है. तो 3 principal supplies हैं. That is your LHS, that is your left gastric artery, common hepatic artery, as well as the splenic artery. Now, ये जो splenic artery है, just to give you your objective, I'm going to highlight the splenic artery so you know these are the branches of the splenic artery. तो ये जो है ये splenic artery है. So splenic artery, when it reaches to the spleen or the splenic hilum, it is now going to give rise to 2 other branches. One is going to be your short gastric arteries. Your short gastric artery, it's a retrograde supply. पीछे से आता है, ठीक है. It is now going to supply to the greater curvature, or I can say the fundus of the stomach, and the same thing will also give rise to the left gastroepiploic artery. इसी लेफ्ट गैस्ट्रो एपिप्लॉइक आर्टरी का एक और नाम है. दिस इज ऑल्सो ऑल्टरनेटिवली नोन एज द लेफ्ट ओमेंटल आर्टरी. This is also referred to as the left omental artery. ठीक है. Then you have the left gastric artery. So just for the significance, I'm just highlighting this is your left gastric artery. This happens to be your left gastric artery that is present. Okay. Now this common hepatic artery that is present, this common hepatic artery will now divide into hepatic artery proper. It will divide into hepatic artery proper and the gastroduodenal artery. It will divide into gastroduodenal artery. Now this gastroduodenal artery is going to go behind the duodenum. It is going to go behind the duodenum. Once it comes down towards the pancreas, it is going to divide into two vessels. That is your posterior superior pancreatoduodenal artery and the anterior superior pancreatoduodenal artery. So it will divide into two. One is your anterior, another one is posterior. So the anterior superior pancreatoduodenal artery, the anterior superior pancreatoduodenal artery will continue together. It is going to form, it will continue to form the right gastroepiploic artery, or also called as the right omental artery, and obviously these two vessels are going to anastomose. So you can see the left gastroepiploic artery is actually a branch of your splenic artery. It's a branch of your splenic artery, and I would say this which is present here, this is the gastroduodenal artery. This is the gastroduodenal artery. It is splitting into two vessels, that is anterior, the anterior superior pancreatoduodenal artery, posterior superior pancreatoduodenal artery. The anterior superior pancreatoduodenal artery continues to form, or it goes to develop into the right gastroepiploic artery. This continues to form. So this happens to be your right gastroepiploic artery, or this is also called as the right omental artery. This is also referred to as the right omental artery. Also referred to as the right omental artery. But all the PDF of the notes is shared soon after the class on our Telegram group. That is, my own group is there. That is the surgery guy, also on the PW MedEd. Both of them are, we are going to share. Okay. Now here you can see the common hepatic artery is now divided into the gastroduodenal artery. It is the gastroduodenal artery, and this is your hepatic artery proper. This is going to be your hepatic artery proper. It's going to be a hepatic artery proper. It's going to be here. Right. Now you will see at the same time the common hepatic artery also give rise to another vessel, and that vessel is what we call it as the right gastric artery. So the right gastric artery is now going to supply to the lesser curvature of the stomach. Right. So from the same vessel which is seeing here, from the same context, this is your right gastric artery. This happens to be your right gastric artery, and this right gastric artery is a branch of your common hepatic artery. Okay. If you look at this, it is now supplying the entire portion of the stomach. It looks, but this is more than enough for NEET PG beta. If you are following the BLS series, every single thing we are discussing in such a detailed manner that it is actually more than enough for your NEET PG or any other exam that you're going to appear. Okay. So let's keep it here. So this is how your blood supply to the stomach is going to look like. Now I know it looks a little bit of hodgepodge. You're like, there's so much amount of information. How do we cram it? So what we do is, we'll keep it very simple. So I will keep this as a representation of the stomach, and we'll try to understand that this stomach is being supplied by three major blood vessels, and we'll try to understand all three major blood vessels which are going to be a part of this. Right. So when you look at this, I told from the celiac artery, if you take this as the representation of the celiac artery, from the celiac artery, there are three major blood vessels. That is, in mnemonic is left hand side. That is, this is your left gastric artery. This is what is there. Another one is going to be your splenic artery, which is going to be supplying like this. So this happens to be the splenic artery, which is going here, which will supply to the spleen. In a retrograde fashion, it will supply to that of the funda. These are short gastric arteries. This will give rise to another blood vessel. This is your left gastroepiploic artery. This is your left gastroepiploic artery. This is about your splenic artery. Next comes your common hepatic artery. So the common hepatic artery, which is going to be present here, the common hepatic artery will give rise to the right gastric artery. The common hepatic artery which is present here, let's say put it here, the common hepatic artery which is present here, which will provide to the right gastric artery. It is going to give rise to the right gastric artery. It is going to give rise to the right gastric artery. It is going to give rise to the gastroduodenal artery, and then it will give rise to the common or the hepatic artery proper. Right. Now this gastroduodenal artery will go behind the stomach. It will split into the anterior superior and the posterior superior pancreatoduodenal artery. This anterior superior pancreatoduodenal artery will continue to be itself and form the right gastroepiploic artery. These are the three blood vessels which are supplying to the stomach. Nothing spectacular about it. Okay? So if you have understood this, a combination of these is what is going to be the orientation of the stomach. If I have to simply label it, this happens to be the celiac artery. This happens to be your left gastric artery. Right? This happens to be celiac artery. This is your splenic artery. This happens to be your short gastric artery. This happens to be your left gastroepiploic artery. This is a left gastroepiploic artery, right? Now, this is again your celiac artery that is present. Now, from the celiac artery, this is your right gastric artery. This happens to be the hepatic artery proper. This happens to be the hepatic artery proper. This is your gastroduodenal artery. Now, this happens to be the posterior superior pancreatoduodenal artery. This happens to be the anterior superior pancreatoduodenal artery. And this happens to be your right gastroepiploic artery. Right? Yeah. So whatever I have done in a split fraction is what you have the entire orientation of the stomach, right? So far, any questions, quick feedback? बेटा नीट 2026 अगर आप BLS फॉलो कर रहे हो, आई प्रॉमिस यू डोंट नीड टू गो एंड फाइंड एनी अदर सोर्स फॉर सर्जरी. बेटा when you talk about surgery, there's a very misconcept that you'll think only about surgery. Hey, beta, when we talk about surgery, we always cover the anatomy. So you are covered with systemic anatomy. We cover all the radiology. We cover the basic physiology. We cover the basic pharmacology. We cover in detail about pathologies and the pathophysiologies, and then a bit of medicine and surgery. So BLS alone, if you write any exam, you will be able to score. Let's say if you're an INICET, you will have at least 50 to 60 questions only from the BLS lecture. Okay, if you're going with your NEET PG where you have a combination of 300 questions, you will be able to answer at least 70 to 75 questions based upon BLS. So that's the power of understanding surgery per se. ठीक है, तो अगर आप BLS रिलीजियसली फॉलो कर रहे हो और आप 2026 का नीट पीजी या फिर INICET टारगेट कर रहे हो, बेटा ये अकेला लेक्चर, राइट, this is going to give you more than, if you put it across, it will give you more than 50 questions in INICET or more than 75 questions in your NEET PG. It is damn sure. ठीक है, that happens. Clear? ठीक है, give me 1 second. I forgot to get my water today. Hold on for a second. Somebody saying NEET UG. बेटा हम NEET UG के लिए नहीं पढ़ाते हैं. Okay, can you move on? चलो. So this was the basic blood supply of the stomach. Very very important. ये जो टॉपिक है इसको आप 4 चांद 5 सितारे. So in the stomach histology, we'll talk about the various types of cells which are going to be present. So our objective is to look at the what are the various types of cells. So on one column we will write the cell type. On the other column we'll say what is the most common location, and we'll try to describe its basic function. Right. So we're talking about 3 different components which are going to be present here. Right. So we're talking about the cell type. I'll be looking at the basic location and the function. So now when you talk about what are the different types of cell types you have, the number one is going to be your mucus cells. These are the mucus cells. The most common site is going to be the body of the stomach, and their basic function is going to produce mucus and bicarbonate. It produces mucus and bicarbonate. Remember, the bicarbonate is going to neutralize the acid, so hence it is also going to be very very important from the basic perspective. Right. Now apart from that, another very important cell which is what we call it as the parietal cell. Now parietal cells, the maximum concentration will be seen in the body and the antrum of the stomach. It will be seen in the body and the antrum of the stomach, and they produce hydrochloric acid and something called as the Castle intrinsic factor, and produce Castle intrinsic factor. They produce hydrochloric acid and the Castle intrinsic factor. I hope everybody knows what is the basic function of the Castle intrinsic factor. Beta, do not say B12 absorption, because B12 absorption occurs in the terminal ileum. It is a B12 transporter, right? So Castle intrinsic factor binds to vitamin. It binds to vitamin B12, right? So that is the basic objective of Castle intrinsic factor. Now apart from that, what are the other cells that we are going to have? We're going to have something called as the chief cell. The maximum concentration of chief cells is also going to be in the body of the stomach, and they produce pepsin, which is responsible for protein digestion. Then you have enterochromaffin-like cells, which are called as the ECL cells. The maximum concentration of ECL cells is also present in the body, and they produce a compound which is called as histamine. We'll tell you what is the basic function of the histamine. It's proreactive. Then you have the gastrin cells. The gastrin cells are also commonly called as the G cells. So either you can call it as G cells, or they're also called as the gastrin producing cells. The maximum concentration of G cells, it is going to be the antrum of the stomach, and they produce a compound that is called as gastrin. And the last that is going to be important is going to be D cells. The maximum concentration of the D cells is going to be the body and the antrum of the stomach, and they produce a compound that is called as the somatostatin. They produce a compound which is called as the somatostatin, right? So these are all the important cells which are present inside the stomach, and their basic function is there. So your mucus producing cells are going to produce mucus. They are present in the body. The parietal cells produces hydrochloric acid and the Castle intrinsic factor. They are also present in body in the antrum. Chief cells, they produce pepsin. ECL cells, they produce histamine. G cells, they produce gastrin, and D cells, they produce somatostatin. The one thing that you have to realize, that all the cells maximum concentration is there in the body. All the cells have the maximum concentration in the body. Only one exception, that is going to be the rule. It is going to be the G cells. The maximum concentration of the G cells is present in the antrum of the stomach. The antrum also have the parietal cells as well as D cells, but antrum alone, the maximum concentration you can see, that is going to be for the G cells or the gastrin producing cells, right? So these are the basic objective. Now, why do you want to know about this? The reason you should know about it, it is to understand the acid physiology, right? So with this into consideration, we'll talk about the basic acid physiology, right? We're going to talk about the acid physiology. So let's understand what is happening with respect to the acid physiology, right? Now, when you look at the stomach, now I can have two states. One, the stomach is empty, another one is stomach is full. Let's say right now you are attending my class without having a dinner, so I am considering your stomach is going to be empty. Logically, you think, agar stomach is empty, do you want more amount of acid to be produced or less amount of acid to be produced? अगर खाया कुछ नहीं और एसिड ज्यादा बनेगा तो ऑब्वियसली स्टमक में डैमेज होगा. तो बॉडी बोलती है कि भाई मुझे ना ज्यादा एसिड नहीं बनाना, मुझे ये करना है कि जितना हो सके उतना सप्रेस करके रखो. ठीक है, लॉजिक यही है ना कि ऐसा कुछ नहीं होना चाहिए कि खाया पिया कुछ नहीं और ग्लास थोड़ा 12 आना, ऐसा प्रॉब्लम हो जाएगा, फिर तो लॉस में चले जाओगे ना. तो बॉडी बोलती है कि भाई मुझे अपना लॉस नहीं कराना. तो व्हेन द स्टमक इज एम्प्टी, so try to understand, on an empty stomach, the basic goal, the acid should be produced less. ठीक है, so whenever the stomach is empty, on an empty stomach, you don't want the acid to be produced more. ठीक है, if you don't want the acid to be produced more, so you have your parietal cells which are present, which are the single most important factor. So I'll just write, let's say this happens to be our parietal cell. So I don't want our parietal cells to be stimulated. So let's say these are the representation of your parietal cells. I don't want these parietal cells to be activated. So I want these parietal cells to be suppressed. Okay? So when you're not having any meal, if the stomach is empty, empty stomach is basically, if you talk about it, these are your D cells, right? So if you're not eating anything, on an empty stomach, what is going to happen? The empty stomach basically activate the D cells. These are your D cells, right? If they activate D cells, they produce stomatostatin, right? Now, when they produce somatostatin, when they produce somatostatin, what is their effect? Now, their effect is number one on the G cells, right? Now, G cells are your gastrin producing cells. So, let's say there is a representation of the G cells. So, what does your somatostatin does? Now, the somatostatin which is produced, this is going to inhibit, these are your gastrin cells, or we simply call it as, so somatostatin basically inhibits, the somatostatin is going to inhibit the G cell. It is going to inhibit the G cell, so it will not allow the body to produce any form of gastrin, right? Another thing, that these cells are going to do, you have your enterochromaffin like cells, right? So you have your enterochromaffin like cells. So these are your enterochromaffin like cells. So these enterochromaffin like cells, they produce histamine, and the histamines basically irritate the parietal cells. So these are your enterochromaffin like cells. The somatostatin will also inhibit. It will also inhibit the enterochromaffin like cells. Now, because on an empty stomach, the D cells get activated. Activation of D cells will cause inhibition, or I can say it will cause a negative feedback on the G cells and the ECL cells. So they cannot produce gastrin, nor they will be able to produce your, I would say, the histamine, which is produced by enterochromaffin like cells. Okay. Now, let's say the patient consumed meal. Okay. Now it's the time the patient says, enough, I am going to have some food. Now the food is going to be going in. Let's say the patient consumes meal. Now let's say the patient decides कि अब मुझे खाना खाना है, and you have now consumed meal. Okay. Now you have consumed meal. What is going to happen once you consume meal? Once you consume meal, the first thing that you will notice that the meal is going to stimulate vagus. It is going to stimulate the vagus nerve. If the vagus nerve is stimulated, it will produce a compound which is called as the acetylcholine, right? So, minute you eat, the vagus is going to get stimulated. The stimulation of vagus will produce a compound which is called as acetylcholine. It is going to produce a compound. It is going to produce a compound which is called as the acetylcholine. Now, what is the effect of the acetylcholine? The first thing this acetylcholine will does, it will go and inhibit the D cells. The first thing it does, it is going to inhibit the D cells. If it inhibits the D cell, all these, what is the D cell? That somatostatin production will stop. That means the inhibitory effect on G cells will be lost, as well as somatostatin will be lost. First thing. Okay. Second, the acetylcholine is going to go and stimulate the G cells. When they stimulate the G cells, they produce gastrin, and when they produce gastrin, this gastrin will go and stimulate the parietal cell. Once they stimulate the parietal cell, it is now going to produce the hydrochloric acid and the Cassel intrinsic factor. They'll produce the hydrochloric acid and the Cassel intrinsic factor, right? That is the first thing which is going to happen, right? The same thing, this acetylcholine will now go and stimulate your enterochromaffin like cells. It is going to go and stimulate your enterochromaffin like cells. When it stimulates the enterochromaffin like cells, it produces a compound which is called as histamine. Now this histamine will also stimulate the parietal cells. It will also stimulate the parietal cells, and stimulation of parietal cell will cause excessive release of your hydrochloric acid and the Cassel intrinsic factor, which is now going to increase. Moreover, the acetylcholine, which is produced by the vagus, will go and directly stimulate. It will go and directly stimulate the parietal cell, further increasing the production of your hydrochloric acid, right? so further increasing the production of your hydrochloric acid. Okay. If you look at this, this is the whole cycle of the acid production that is there. If you look at this, it looks a little bit, again over the bound, but it is very simple. On an empty stomach, the D cells is dominant. They produce somatostatin. They inhibit the G cells, ECL cells. Nobody is stimulating the parietal cell, hence there is no acid production. The minute you start eating the meal, they stimulate the vagus. They produce acetylcholine. The first thing the acetylcholine does, it inhibits the somatostatin or the D cells. When the D cells are inhibited, there is no stimulation to G cells or your intrachromophile like cells. Their subside or their effect on the somatostatin is nullified. Okay? The minute acetylcholine comes, it inhibits the D cells. There is no somatostatin. That means they cannot inhibit the G cells or the intrachromophile like. Meanwhile, acetylcholine stimulates the G cells, enterochromophile like cells, and the parietal cells in order to increase the production of hydrochloric acid. Is that clear? Is that clear? Quick feedback. Clear? ठीक है? So this is about the basic acid physiology. Now, if the question has been asked, what is the most potent stimulator of the parietal cells? Remember, the most potent stimulator of the parietal cells, it is going to be acetylcholine, or simple the vagus. The 10th cranial nerve or the vagus nerve is considered to be as the most potent stimulator of the parietal cell. Okay. So this is with respect to the basic acid physiology. Now, as I told you about the vagus, quickly talking about the vagal anatomy. To talk about the vagal anatomy, again, very, very important, right? When you talk about the vagus around the stomach, let's say this happens to be the esophagus, and let's say this happens to be the stomach that is present here. Now, just for the sake of understanding, let's say this happens to be the diaphragm that is present, right? So when you look at the vagus nerve, when the vagus nerve is running inside the thorax, their orientation is going to be in the left and the right direction, right? So just for the sake of understanding, this happens to be the right vagus, and this happens to be a left vagus, right? The minute they become intra-abdominal, that means when they are going to pierce the diaphragm, just for the sake of understanding, this is how the diaphragm is present, and just for the sake of understanding, I'm just going to highlight the diaphragm in this particular. So let's say this is the diaphragm that you have, right? Now in either ways, when you look at the vagus that is going to enter, the vagus is going to pierce the diaphragm, and then the orientation is going to change. The left vagus is going to continue as the anterior branch, and the right vagus is now going to become the posterior branch. It pierces the diaphragm, and then it goes behind the stomach and then becomes posterior, right? So the orientation is very, very important. So this is now what we call it as the posterior vagus. This is what we call it as the posterior vagus, and this happens to be your anterior. This happens to be your anterior vagus, right? The standard mnemonic to remember this orientation is what we call it as the LARP. That is, your left becomes anterior, the right becomes posterior. Okay? So the left becomes anterior, the right becomes posterior. This is what you have to remember with respect to that of the vagus orientation. Now, what are the various branches that you are going to have, right? So we'll talk about the anterior vagus and the posterior vagus separately. So we'll be discussing what are the branches of your anterior vagus and what are the branches of your posterior. So you have the anterior vagus and the posterior vagus. We'll try to have the orientation for both of them, right? So let's say this happens to be the esophagus and this happens to be the stomach, right? So what are the branches that you're going to have with respect to this, right? Let's say this happens to be the diaphragm that you're talking about, and this is the vagus, right? So we're talking about the left and the right vagus. So this is the left vagus. Now this has become anterior. We'll talk about the branches of this, right? Now the first branch that you will see is going to be the hepatic branch. It will supply to the gallbladder. This is what we call it as the hepatic branch of vagus. This is what we call it as the hepatic branch of vagus. Now the hepatic branch of vagus, they're going to be supplying to the motor, to the gallbladder and the motor supply, right? Then they have the short gastric nerves which are present, which are going to supply the anterior surface of the stomach. And at the end, you will see there are tuft of nerves which are present. This is called as the anterior terminal nerve. This is what we call it as the anterior terminal nerve. It is the anterior terminal nerve of Latarjet. Or in simple word, it is also called as the crowfoot. It is also referred to as the crowfoot nerve. Also referred to as the crowfoot nerve. Yeah. Quick feedback. Clear everything? Okay. So when you have the anterior vagus, I'll just बहुत किनारे पे हो गया है थोड़ा बीच. So the anterior vagus has the hepatic branch. It has got the short branches. Then it has got the terminal nerve of Latarjet, or also called as the crowfoot nerve. It is also called as the crowfoot nerve. They call these short gastric branches. They are called as the short branches, gastric branches, also called as the seromuscular branch. They are also called as the seromuscular branch, right? So these are the, I would say, the anatomical orientation of your anterior vagus. Now the same thing if you repeat with the posterior vagus. So let's say this happens to be the representation of the esophagus. This happens to be the stomach. This happens to be the diaphragm. This is the vagus that you have. Now talking about the right vagus. So this was the right vagus, this was the left vagus. The right vagus, this is the left vagus, right? Now what has happened is the right is going to become posterior. So you will now notice that as it pierces, it goes behind the stomach and then it is going to travel all across, right? So this is your posterior vagus. Now as it is arising, it will give rise to a branch which is called as the celiac branch of the vagus. Now this celiac branch of the vagus is going to supply to the celiac nerve plexus. So this is going to control the peristalsis of the upper GI tract, right? So this is what we call it as the celiac branch. We'll use a different color so that we understand better. So posterior vagus, this is your celiac branch. it supplies to the celiac plexus, and then it controls the peristalsis basically, right? Then you will see that there's another nerve that is going to be originating from this part, and then it runs on the posterior surface of the stomach. Now this is what we call it as the criminal. It is called as the criminal nerve of Gracie. This is what we call it as the criminal nerve of Gracie. We call this criminal nerve of Gracie is because if you miss this nerve during a vagotomy and if it is left behind, this is going to cause recurrence in peptic ulcer disease. ठीक है, तो इसको criminal इसलिए बोला गया कि अगर आप इसको भूल गए ना तो ये आपको रुला देगा वापस, ठीक है, ये आप पे वार करेगा, ये वापस अल्सर क्रिएट करेगा. Hence the criminal nerve of Gracie is the name. The word criminal here basically means that if you miss this nerve is going to cause recurrence. Very, very important. Okay. Apart from that, it will also have the same short branches, which are the seromuscular branches. It will have the seromuscular branches. At the end, it will also have this tuft of bands, and these tuft of bands are your crowfoot, right? So these are your seromuscular branch. This happens to be your seromuscular branch, and this happens to be your terminal nerve of Letarget, and that is going to be on posterior surface, and this is also called as the posterior crowfoot, also referred to as the posterior crowfoot. Okay. So when you look at the differentiation, when you look at the differentiation between the anterior and the posterior vagus, that is right in front of you. Okay. So क्या फर्क है? You will see one is celiac branch, which is going to control the peristalsis. Then you have the criminal nerve of Gracie. The other two branches are same, that is the seromuscular branches and a terminal nerve. So when you talk about vagotomies, if you know these two orientation, you will never go wrong. Okay. So this is all the basics of the surgical anatomy of the stomach that you are supposed to know. If you have any questions, any queries, you know where to get us, right? So I'll just tell you, reach out to us on the Surgery Guy channel. Now this Surgery Guy is there on the Instagram. It is also there on the Telegram. We usually share all the notes on this channel. It is by my name, that is Dr. Sandeep Sriram Reddy. Any questions, any queries, you can reach it down here. You can also find the same in our PW MedEd app as well. You'll be seeing this on the PW MedEd app as well. Okay. So, thank you so much for joining today. We'll resume tomorrow with the disorders in the stomach. आज के लिए इतना काफी है. Take care. Read well, sleep well. Continue to learn well. I'll share this PDF. Go through it. Anatomically, stomach is a little bit challenging, but if you understand this orientation, how it has been depicted, let it be the vagus or the acid physiology or the celiac plexus or the orientation, right? We try to break it down in simple points so that you understand it better without missing even a single point. With that, thank you so much for joining today. We'll resume tomorrow night at 9 o'clock. Until then, good night. Take care. Bye bye.